Hey everybody, it's Dr. Beyer again, from Beyer Chiropractic in Frankfort, Illinois, doing another case study of a chronic care patient, a chronic condition patient that we helped out with our functional medicine, functional neurological approach that we utilize for a lot of the chronic people that we treat. This particular person was a 47-year-old male who was complaining of fatigue, a lot of GI symptoms, including cramping and bloating and GI pain, as well as bouts of diarrhea. And also having brain fog, just really decreased ability to kind of think clearly and forgetting things and things like that. I picked this case study because a lot of times people think that, with thyroid problems and with fatigue and issues like that, it's only women, but men can get these issues too. It does tend to be more often with women, unfortunately, but men can get these issues too. And so this individual came to us to get examined and treated, having not gotten relief with the traditional medical route and even trying some other holistic, natural approaches kind of on his own and through a few other doctors who quite honestly knew a little bit about nutrition, but not enough obviously to identify the key issues that he had. So we did the initial blood work on him, and what the initial blood work showed was that he did in fact have a thyroid problem, and his particular type of thyroid problem was a common one in the United States, in that he had an autoimmune thyroid issue called Hashimoto's. So his immune system was recognizing his thyroid as being foreign and attacking it and gradually destroying the tissue, which obviously contributed to the fatigue. But he had other metabolic imbalances or metabolic issues that the blood test showed up. He had what's called insulin resistance, which is where the blood sugar is higher than it should be, but not enough to be diabetes yet. That's a definite problem, needs to get addressed, and we did. He had, in conjunction with that, what we call fatty liver, which is where the liver is showing some dysfunction via the blood markers that indicate some fatty infiltrates are developing within the liver, causing it to not function properly, which contributes to the blood sugar issues, as well as toxins building up within the system, because your liver is your filtration organ. And he also had a real severe vitamin D deficiency. There were some other things abnormal on the initial blood test that warranted a need to do some other laboratory testing, and we did a stool microbial test where we had the patient collect a stool sample, and we utilize a lab that does a check to see if there's any kind of microbial infections to bacteria or parasites or yeast. And lo and behold, he did have a bacterial infection to a bacteria called Helicobacter pylori, which contributed to his GI symptoms, but also, if it remains uncorrected, can cause ulcers. In fact, ulcers are most commonly caused by a Helicobacter pylori infection. So it was significant that we identified that. And then we needed to do some salivary hormone testing, which showed some real decreased levels of a hormone called cortisol from your adrenal glands. That contributed to the fatigue also, as well as the blood sugar or irregularities or the diminished ability to be able to regulate good blood sugar levels. And we needed to do some food sensitivity testing. And interestingly enough, one of the most common things that people tend to be sensitive to food item-wise, he wasn't, which was gluten. But we also do some real detailed food sensitivity testing with some patients and check for some other items that tend to cause problems with some people. And we were able to really fine-tune his diet, because we found some sensitivity to potato and soy, amaranth and quinoa, which are actually gluten-free grains, oats, and dairy. It would take years and to be able to trial and error figure this out, those particular food items that he was sensitive to, and you probably would never, even after years, figure it out. So this specialized food sensitivity testing was super, super helpful, because it enabled us to, just in a very short period of time, really fine-tune his diet and get the GI tract healed up. So we did an approach where we worked on those issues. We worked on the specific autoimmune issue that he had, and did some protocols to balance the immune system so it's not attacking the thyroid as much. We did some specific nutritional interventions, nutritional therapies. We did some interventions or some treatments which actually eradicated the Helicobacter pylori infection. We did a follow-up test on that, and that was negative. We got the cortisol levels normalized out. As I was talking about, we fine-tuned his diet, not having to go through any trial and error elimination diets or anything like that. And within a month, and now he had been suffering with these symptoms to the point where it was affecting his work. He put on the initial paperwork that he came in, it's affecting his work. He's not able to work. He's missing. He's losing money. It was affecting finances because he's losing money due to decreased time away from work. It was affecting his marriage and his relationship with his kids, and also his sleep. His sleep had been affected, which was directly due to the cortisol levels, actually. So he had been suffering with this for a long time, and it was really profoundly negatively affecting his life for a number of years. And within 1 month, or excuse me, within 2 months, he rated his fatigue improvement, his improvement in his fatigue levels at 40%. The GI symptoms within 2 months had improved between 70 and 80%, and the brain fog 65%. And at the end of a 5-month treatment plan, the fatigue had improved to 70%, the GI symptoms 80 to 90% improved, almost totally gone, and the brain fog had improved 80%, again, almost totally gone. Excellent example of the kind of results that you can get with an approach where we specifically identify with the right laboratory evaluations exactly what's going on and then address that, not guess. And then combine that with an approach where we get the nervous system controlling everything, and people get these kind of results. That's what we do, a neuro-metabolic approach with these chronic type conditions. And people get excellent results, just as this gentleman did. Again, within 5 months, he's pretty much got his life back from this chronic condition that had been bothering him for so long. So if you're watching this and you're like this gentleman and have gone through some different protocols that hasn't worked too well, give the office a call, 815-469-8500. Set up an appointment to come on in, and we'll do an evaluation and get to the heart of what's bothering you and help you get your life back.